Across Africa, people are finding local solutions to the global challenge of coronavirus. From technological innovation to community collaboration, ordinary people are using the resources at hand to address the unprecedented challenges they face. In Senegal, 3D printers are being used to compensate for a lack of medical equipment in health centres. A local technology group has mobilised 3D printers in small workshops throughout the country to make plastic visors for healthcare workers. In Dakar, workshops print and assemble dozens of masks every day before delivering them free of charge to hospitals, pharmacies and clinics.
We saw that there were a lot of initiatives in other countries in relation to equipping doctors. In Senegal, we have a problem regarding equipment and resources. We had a 3D printer, so we started manufacturing because we could help.
Similarly, in Liberia's capital, Monrovia, residents are taking matters into their own hands by setting up neighbourhood checkpoints to screen the temperature of those who enter and make sure that they wash their hands, a strategy used during the Ebola outbreak a few years ago.
There are some Liberians are still doubting that the sickness is not in the country. That's all their belief. So when they saw the guys putting those cakes and things down, telling people to wash their hands, having the instrument testing and taking the temperatures and things, some try to get the art that indeed it is true.
Meanwhile, in South Africa, President Cyril Ramaphosa announced a historical $26 billion relief package to support the economy and the country's most vulnerable people. This comes after violent clashes with police in some areas over food parcels amidst one of the world's strictest lockdowns.
Another significant area that requires massive additional expenditure is the relief of hunger and social distress in our communities across the country.
However, some local measures elsewhere have raised eyebrows. Madagascan President Andry Rajoelina is promoting a drink that he says can prevent COVID-19 and cure infected patients. Based on local medicinal plants, the concoction is prepared with Artemisia, a plant with proven success to treat malaria. No published scientific study has shown that the COVID Organics herbal tea is effective in treating the coronavirus. Even so, the military is now distributing the drinks to residents, and students who are returning to school after a month of confinement are given the drink in class. Alternative medicine is nothing new in the Democratic Republic of Congo, where those looking to alleviate symptoms of cough and fever head to the market stalls in Kinshasa. Traditional healers say the Congo bololo leaves alleviate coughs and fevers when boiled. Meanwhile, health workers and doctors in Malawi are refusing to work until the government provides them with personal protective equipment and better pay in the wake of the coronavirus pandemic. At Kamuzu Central Hospital in the capital Lilongwe, many patients were forced to return home as there was nobody there to attend to them. In Uganda, Kampala city authorities are providing shelter to street children during the nationwide lockdown. 180 of the most vulnerable children have been housed in a primary school.
When the lockdown happened, we had children that live and work on the street, and when the directive to stay at home was made, they did not have a home to go to because their home is on the street.